Back in June, Kim Hodgson-Cramp's daughter became incredibly sick.
A temperature of 105, her breathing, like I watched her whole body work with every breath. I was terrified as a parent.
6-year-old Kavanaugh was first treated at an Edmonton Community Health Centre. And while an ambulance was then called to bring her to the Stollery Children's Hospital, it would take 33 hours before it got there.
By the time we got to Stollery, the paramedics spoke with emergency and they put us right into the waiting room with everybody else. And it was another 6 to 8 hours before we got a room.
Lengthy wait times for emergency care have become all too familiar right across the country. But beyond being frustrating, those wait times are now costing lives. Last weekend, Montreal area physician Dr. Sébastien Morin shared this tragedy online. I ended my night on a patient who died in front of me with a ruptured thoracic aorta. This same patient had waited 16 hours yesterday in another hospital without being seen for his pain. He left. I couldn't do anything. He died within minutes of his arrival.
It's up to patients to tell their individual stories, but I can, share that a very similar situation with different problems is happening on average once a month in this province that I'm aware of.
According to Dr. Warren Thirsk, since May in Alberta alone, 7 patients have died waiting for emergency care.
These are people who are dying while waiting to be assessed to see what care they need.
I think that this will continue to be a problem in Canadian healthcare until we address the health human resource crisis that we're faced with right now.
It's why the president of the Canadian Medical Association says the country's 13 provincial and territorial health systems need to start working together to find solutions fast.
We all know that there's a crisis. What we're waiting for is action.
A country-wide health crisis in need of critical care. Heather Urix West, Global News, Calgary.